Are you still using the same protocol for every pediatric patient and hoping they'll just work? If you're curious how traditional Japanese acupuncture can treat a pediatric cold utilizing Shonishin without needles or overcomplicating things, then you're going to want to watch today's video. Hi everyone, I'm Maya Suzuki with ShinKyu University, and in today's video, I'm going to walk you through how to easily treat colds in children utilizing Shonishin and moxa in a way that kids love and that the parents will thank you for. If you're interested in learning more about how to up your game with not only Shonishin, but all foundations of traditional Japanese medicine, including moxa and palpation and hara diagnosis, then you're going to want to set up a chat with me. There's a link for that in the description box below. I first started studying Shonishin when I was a student at Toyo ShinKyu Senmon Gakko. My son, Sky, was at the time born during my first year of school, and I was super excited to learn how to treat him. Now, Shonishin was not an optional class in my education. It was something that we all learned how to do because Teishin tools that are utilized within Shonishin and other types of non-insertive tools are actually something that most traditional Japanese acupuncture practitioners are at least familiar with or use in their practice. I was super excited about this and continued to learn not only with my teacher outside of school and started to treat my child and also his friends that we were meeting in town, but I was really excited to start utilizing in clinic. Now, unfortunately, at the time, I was working in a clinic in Japan called Acupuncture Clinic that focused specifically on fertility. So because of the policies of the clinic, I was not able to start treating Shonishin or pediatrics in that clinic setting. So I was treating a lot at home. Now, once I moved back to the States and got my license back here, I started treating Shonishin predominantly in my practice, Bumblebee Acutherapy. So right now, currently, my practice is 50% children and about 50% OBGYN and other people. So what I'm teaching you today is something that I use every single day in my practice. It is super, super effective. And what's really important here is you really want to know where the jaki or that pernicious element is in the body, what's happening in the body as far as deficiency, excess cold and heat, and you're also going to want to understand where is the toxins in the body in that natural state for the child, meaning when they're not noxiously activated, when they're not causing issues for the patient. Now, that was a bunch of theory that I just ran through. Again, if you're really interested in learning about that, schedule a chat with me. We can totally talk through how to start implementing those ideas in your practice. Now, before I get into the treatment, I would love to know how many of you watching this are currently treating children in your practice. Let me know in the comments below. All right, so let's get straight into the practice. We're going to start first with palpation and then move on to the actual Shonishin practice. When you start out treating a child, and an adult for that matter, the most important thing to do is to make sure that you're palpating first and truly understanding what you're looking for. Now, some of the things that we go over in ShinKyu quite a bit with the students with anybody's treatment, whether it's a little one or if it's an 80-year-old grandma, is that you want to make sure you understand 5 key elements. Those are deficiency, excess, cold, heat, and jaki. Every single time, those 5 things. Cool? Cool. So we're going to move in order for my treatment of the Yashinimichi kata. Now, depending on the style of acupuncture that you do, whether that's Japanese meridian therapy, or like me, Iyashinomichi, or Shakuju, or Toyohari, how you move through the hara diagnosis will change slightly. So just take that into consideration, that what I'm doing is based on my style. And if you're interested in learning fukushin or hara diagnosis a little bit more, I do have some videos here on my YouTube channel for that. And again, that's something that we teach all the time in ShinKyu. Now, one of the things I love about this little client, who I know very well, is that she has a little neck scarf on. This is something that I'm going to recommend you do for all of your clients who are sick, is that they put on like a silk neck scarf, because it's going to allow their skin to breathe and also keep DO14 nice and warm, which is often where the pathogen or the jaki enters. It also allows them the ability to sweat, which is really, really important when we're in a situation like Guizhou or Gigentang or Mahuangtang, which is really this, anywhere between those 3 is the symptomology of an acute cold for most people. Okay, so we're going to move through. Is it okay if I palpate you? Yes. Always make sure you ask your client. I know this client very well, so I didn't ask. But we're going to check the chest. There's a little bit of jaki and heat up here. Do you have a cough, sweetie? Yeah. Yeah, you do. Where's your nose stuffy right now?
Like right here. Right there? Okay. When you blow, can you get it out? No, doesn't come out. So again, I'm not going to teach you how to go through and do all of these places on the Hara diagnosis, but really we're looking for what's systemically happening in the body. And then in relation to that, what meridians do we want to treat, both on the legs, on the arms, what's happening for the symptomology, what's related with the zangfu. So in that short little period of time, just looking at the Hara, we're able to figure that all out. Now, of course, we can compare that back to the tongue. Do you want to stick your tongue out for me? Right? And it's quite white in the middle jowl, pretty red on the tip. And it's a little shaky. So we're going to now take our tools and we're going to treat. Now, to be quite honest, I don't look at the tongue a lot for children, just because I don't in my treatment, but I do highly suggest that you do. It's a good source of information. Now, there are a ton of different tools you can use when treating a child. I'm going to be using a little teeny gold Teishin. It looks like, well, it is actually a 30 gauge needle. And I'm going to be following what's called the Iyashinimichi kata, and I'm going to be doing that because that's the style of practice that I do. But the most important thing to really think about here is what meridians are running through the affected area and what areas do we have to predominantly treat. So we, of course, should be treating, right, the nose and obviously the lung, perhaps the sanjiao, or even the large intestine channel. Right there. Now, ideally, when we do this, immediately the nose gets a little bit better. It's easier to breathe. Now, kids don't really lie about their symptoms. They don't tell you things to make you feel better. So they're really, really good people to learn from. Okay, big breath. Tell me, where's it, Steffi?
Right here about now.
Okay, a little bit different place. And we're always looking for same, better, different, worse when we're treating. Now, there's a lot of technique that I'm doing right now with this that kind of looks, I'm sure if you're not used to traditional Japanese medicine, a little weird, but there is rhyme and reason to it. Big deep breath. Same place?
But it's gotten a lot better.
Lot better, okay. Now, what's really important is that you understand as you're moving through the body, that you understand where the elements are moving through, and therefore how you should access them. Meaning that if she has a pernicious element, or jaki, here in the upper jowl, what meridians, and because of the placement, what meridians are then going to be the most useful to help move that element out of the body. So because where it is, we can of course think large intestine, and we can think the lung. Is that right? Oh, that's right. Oh, okay. How's your throat?
Wait. It's doing pretty good.
Okay. Is it scratchy anywhere?
No.
Okay. Okay, so we're just going to do a little bit up here, and then we're going to treat your belly.
Yay.
So the really nice thing about Shonishin is that you don't have to insert any needles on a child and still get a really phenomenal result. And that is, in my opinion, one of the best reasons to use Shonishin, is that you don't have to use needles and still get the effectiveness of using them. So one of the things that just happened is my little patient here just took a nice deep breath without thinking about it. And that's a really, really good sign when kiddos take, and adults as well, when they take a deep breath, it means that something felt good and is relieving, and now they're able to breathe a bit more. How's your nose right now?
Oh, it's almost no stuffy.
Woo! Excellent. High fives. Okay. All right. We're going to treat your belly. Is that okay?
Mm-hmm.
Okay. Well, we won't be doing too much, though. So you really want to make sure that you don't allow the body to get cold in these situations, because if the body gets really cold, you're going to allow that pathogen or jaki to recede farther into the body. How's your appetite been today? You hungry?
I ate some breakfast really late, and I didn't eat any lunch.
Didn't eat lunch. Is your tummy, are you hungry right now? Not so much?
Yeah.
Okay. So what I'm doing right now is I'm giving, kind of looks like a flying fish, I'm not gonna lie. It looks a little bit like a flying fish. Look at it, it looks like a flying fish.
Oh yeah.
Well, so what I do is I put moxa points, 4 stick on moxa for my patients to have done at home, obviously with the help of their parents. And then, careful, hon. And then you can stick the moxa on those points. So it's not only for you, but it's also for the patients. And then we just want to make sure that this is just warm. I don't want it to get hot, okay?
Okay.
So when it's too warm, you let me know, we take it off.
Okay.
Okay. Now, this little patient is definitely not 4 years old. If you have a young patient and you're using moxa, I highly suggest before you use it on kiddos that you get some education on how to safely use it. Moxa is one of the most dangerous, you're fine, sweetie, it's not anywhere near it. Moxa is one of the most dangerous substances that you can use on kids because you can cause a blister. So before you decide to start using it on your little patients, I highly suggest get some training on how to do it safely. Right now, I'm not touching it because I know I can trust this little patient to not touch it. She's very versed in the ways of moxa. But if I didn't think I could trust her, like with my 5-year-old, I'm going to hold on to my edges and make sure that there's no way that a flailing hand might be able to touch this moxa.
That's warm.
Is it too warm?
No.
Okay, we're going to leave it on until it's too warm.
Okay.
Now, obviously, this treatment is taking a long time because I'm talking you through it, you there in the YouTube universe. But if I were to do this treatment normally for a 12-year-old, which is how old this person is now, it shouldn't take more than 10 minutes. So to give you an idea. So we're going to do a little treatment on her legs. Now, I know I'm going to get the question of why do you choose these specific points? What's going on with those points? And just to let you know, all of these points are not from protocol. All of these points are because I'm palpating the meridians and finding the most live point on the meridian. So there is no such thing as a point that you must take. There's only points that are reactive and live for the patient. Okay, cutie. Let's have you turn over. Get on your footsies. All right, sweetheart, I'm going to lift your shirt up, okay? So when palpating the back, I'm going to keep my patient's shirt down for now, simply because she's sick and I don't want to get more sick by making her cold. So I'm just going to palpate. However, in your clinic, I don't suggest palpating over clothing. It's very difficult to feel things, especially initially. So we have a lot of excess tension up here in the neck. It's very, very tight all the way down to about gallbladder 21, from the bladder 20-ish area, even maybe a bit higher, all the way down the neck. There is a little bit of jucky there, or pernicious element. It's definitely quite tight along the areas of the 6 flowers, in particular towards the top end of the 6 flowers. So that would be bladder 17, 18, and 20. And bladder 20-ish, again, this is an ish, somewhere around that area is quite deficient. And then also around DO 6 is also quite deficient, which would explain why you're not having any appetite, honey. Okay, so we're going to do a little bit of treatment to release the neck. Can you turn your head the other way, babe? Now, in the initial stages of a cold, I often tell people to do a lot of moxa around due 14. We're past that stage right now. So I'm just going to be utilizing my Teishin tool to disperse and to tonify. In those areas. How's your nose doing, hun?
It's not stuffy anymore. It's feeling way better.
Yay! Love not being stuffy anymore. Yay. So as I tonify this last point, I just want to reiterate that you should really be getting results on your table. So while you're treating your little patient, they should be telling you that they feel better or showing you signs that they feel better right away. This isn't something that should take a ton of time to get done. Now, understanding when a point is sufficiently tonified, when a point is sufficiently dispersed, is something that you really have to train your hands to understand. And that training should come, of course, with mentorship from someone who understands what that means. You got a little moxa here, hun. Okay. When I think that guy went out, let's try to rewind it. The development of a practitioner's hands is perhaps, and development not only of the practitioner's ki or chi, but also the development of their hands and how well they channel energy, channel that ki through their hands, what they are able to pick up and feel is perhaps one of the most important jobs for us as acupuncturists and as healers. So I highly encourage that not only do you practice this with your clients, but that you also get mentorship on board that can help direct you to really build your hands and understand what you're feeling for, when you're feeling it is enough, and all of those things. How does that feel, sweetheart?
It's a bit warm.
Okay, is it too warm? Okay, does it feel good? Okay. Now, becoming a pediatric practitioner is going to mean that you become the go-to person when your little clients get sick, when they're having issues at school, when they're having issues going into their menses, or perhaps when they're going into puberty, right? You're going to be their go-to source for anxiety, for depression, for pain, to help them succeed in sport. All of those things you're going to become the go-to person for it. And so if you really decide to become a pediatric practitioner, in particular using Shonishin and moxa, you're going to become really popular really fast. Is that too warm yet, sweetie? Yeah, you're going to become really popular really, really fast. So just be prepared for that. So last but not least, I'm going to just do a little bit more work on her neck and shoulders. Just make sure that there's a little bit of dispersion happening on the neck and shoulders. Any of that remnant jockey or pathogenic influence that now has risen to the surface, we can get rid of it. There we are. When someone coughs like that, it's almost always because they're trying to get that jockey out of their system. Okay, how you feel?
I feel amazing.
Amazing. Okay.
Way better than
All done.
how I started.
Okay, cool. So if you're interested in how to start being able to do this kind of practice in your clinic, please do reach out to me. Honestly, what I did while I was explaining it, and there was a lot of things that I didn't go into, it's actually not super difficult what I was doing. And it is something that any practitioner anywhere in the world can learn how to do. So I would really love to talk to you if this is something that you want to really start enacting in your practice and start expanding into pediatrics, or to start offering a more gentle version. Again, if you're interested in that, there's a chat for that in the link. There's a link for that in the description box below. Let's talk. Now, if this video was helpful for you, don't forget to smash that thumbs up button and subscribe to the channel. And please do share this video with another acupuncturist that you think might benefit from expanding their practice into Japanese pediatric Shonishin. Now, if you're interested on which Shonishin tool to purchase, you're going to want to watch this video right over here.